Hi, my name is Ellyne Dombro, and I was diagnosed when I was pregnant with my son about 27, 28 years ago, and I have something called PKD. Basically, it's polycystic kidney disease, which is cysts on and around the kidneys. I basically was treated, not necessarily in depth, just kind of keeping an eye on things for several years. And I started with dialysis in 2016, and I was on it for 5 years. I received a transplant in August 6th of 2021. I was listed for close to 8 years, multi-listed through several different facilities, hospitals, and different locations, waiting, and very excited to receive that call, although there's several calls prior to the one that you received. Okay, I decided to become a mentor because starting out in this process, as many of you may know, it is a little overwhelming. I did not even know what kidney disease was. I contacted National Kidney Foundation basically to see if there was any direction for assistance, kind of for us to be guided, because not knowing what this is, you can ask your physician. They give you very little information, although this doctor had said get involved with that organization. So I contacted them, and I was a mentee to another mentor, and I was so thrilled to be able to have that big sister feeling that someone would give you the guidance that you need as a new patient, because you feel like you're alone and you don't know what to do. So giving back is because, as you know, many of us are going through the process. It's nice to give back and help new patients going into this journey, and they don't feel so alone. And I've talked to a few so far, and it's very rewarding for me. It's just a wonderful feeling that you're helping someone else, and you were in their shoes. So it's just very comforting to them as well. I feel that I'm a good listener, and I enjoy talking to different people. And as a mentor to a new patient, I just feel that it's such a benefit to them. They have many questions, and even though I'm not a physician, we guide them, meaning the mentors, and they are always referred back to their nephrologist and their team. However, we can give them guidance as to what we went through. Similar stories, maybe they're having an issue with dialysis versus maybe they weren't feeling that great, and you can give them an idea of maybe it's something with the patient line, or many things that you learn along your journey, which you knew nothing about in the beginning. And as they are also trained in the process, it becomes overwhelming again, just in the beginning. But as a mentor, having gone through it, it's sort of now they're going through baby steps, and I would be most happy to guide them and give them my input of, and listen to their concerns, so that they feel comfortable with their treatment, and not to give up, but just feel that it's okay. You will get through it, and you will stay strong, and you will be positive, and you end up being your own advocate. You have to do what's best, and it's nice to help them, and that's the goal.